Hello everyone, welcome back to the Pharmacology Masterclass series by Dentospedia. It is one of the trusted platform for dental board examination preparation. So the topic for today is classification of antibiotics. This is one of the most important topic in pharmacology module because antibiotics and analgesics are two of the most important drugs that we prescribe as a dental professional in our day-to-day life. So let's start with the classifications. Now, classification, this is very important. MCQ can be asked. Dental antibiotics are classified by how they work, their antibiotic spectrum, their clinical use. This helps dentists to choose the right drug based on the type of oral infection, whether the bacteria is aerobic, that is oxygen, they need oxygen for survival, anaerobic, that is they don't need oxygen for survival, and the patient factors like allergies. Common group of the antibiotics are the penicillin, clindamycin, macrolides, tetracycline, metronidazole are organized into the practical classes to simplify the drug selection, substitution, examination, preparation. Now this slide is very important because many MCQs can be formed from this slide. So you need to have a very clear-cut understanding of this slide and also remember each and every point. Now, first is the penicillin, very common. For example, amoxicillin, pen-VK. Pen-VK is just a VK. V stands for a compound name and K is for potassium. Okay. Now, mechanism is also very important. It inhibits the cell wall synthesis, mostly for gram-positive bacteria, first line for odontogenic infection. Second is the beta-lactam plus inhibitor. Now, you must be knowing that a bacteria is having the beta lactam ring, so it's very strong. So the example of it is the amoxicillin plus clavulanic acid. This is a beta lactam inhibitor, overcome the beta lactamase, and it is broad spectrum, plus it can be used for gram positive and anaerobic. It is for recurrent or resistant infection because it is a broad spectrum. It inhibits the beta lactamase enzyme in the bacteria. Now, third is the leucosamide. It is, for example, clindamycin. It inhibits the 50S ribosome. Now, you must be knowing the ribosome is divided into 30S and 50S, and ribosome is required for protein synthesis. So, it inhibits the 50S ribosome. It is for gram-positive anaerobic bacteria, and it is very commonly used for penicillin allergy. And this now next type is macrolides like erythromycin. It inhibit the 50S ribosome, same thing, and but it have broad spectrum like gram positive and atypical bacteria. It is also used for penicillin allergy, but due to the antibiotic is having very side effects, so it is having the limited use. Now, tetracycline is also very important, like doxycycline, minocycline. It inhibits the 30S ribosome. Now, you have to remember which antibiotic inhibits the 50S and which antibiotic inhibits the 30S. Now, it is broad spectrum, includes the spirochetes also, and it is most commonly used for periodontal therapy. Now, the second last is the nitronidazole. It is a example is a metronidazole, very commonly used. It disrupts the DNA in the anaerobic bacteria, strict anaerobic action, and combined with penicillin for severe infection. If you suspect that the infection is having the anaerobic bacteria, then you need to prescribe metronidazole. For example, in a periapical abscess. And the last is the cephalosporin, like cephalexin. It inhibits the cell wall synthesis, and it inhibit both, that is gram positive and the gram negative, but more gram positive is inhibited, and limited dental use is there. For example, prosthetic and prosthetic prophylaxis, you can be also using cephalosporin. Now this slide is very important. You need to remember. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.